This cream is used to moisturize and treat dry, rough, scaly, itchy skin and minor skin irritations like diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, reducing itching and flaking. Some ingredients protect the skin against irritation, while others work by forming an oily layer on the skin to trap water in. It also contains humectants that draw water into the outer layer of skin, as well as ingredients that soften the top layer of skin cells and help the dead skin cells fall off. The optimal time to apply this cream is after bathing or showering, when the skin is still damp. Apply a thin layer to the affected area and gently rub in. This cream can be used as needed to keep the skin moisturized. Make sure to use Sween Topical cream as directed. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on your skin condition and the product. For example, if you're treating dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you're using this cream for diaper rash, make sure to clean the diaper area well before applying the product. And if you're using it to treat radiation skin burns, check with radiation personnel to see if you can apply the cream before therapy. Be sure to follow all directions on the label for proper use. Only apply the cream to the skin and avoid sensitive areas such as the eyes, mouth, nose, and vaginal/groin area, unless directed by the label or your doctor. And if your skin is very dry, your doctor may instruct you to soak the area before using the cream. For best results, use this cream regularly and apply it to damp skin after bathing or showering. If your skin condition persists or worsens, be sure to seek medical help right away. When using Sween Topical cream, it is important to be aware of the potential side effects that may occur. These can include burning, stinging, redness, or irritation. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, it is because they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, it is important to seek medical attention if you notice any unusual changes in your skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or difficulty breathing. It is important to note that this is not a complete list of possible side effects. If you experience any other effects not listed here, it is important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Sween Topical cream, make sure to inform your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions. If you have skin cuts, infections, or sores, consult your doctor or pharmacist before using this product. Some ingredients in Sween Topical cream, such as preservatives and fragrance, may make you more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take special precautions when in the sun. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, contact your doctor right away. If your skin is prone to acne breakouts, look for the word non-comedogenic on the label, as some products may worsen acne. Additionally, some products may stain or discolor clothing, so be sure to ask your doctor or pharmacist for more details. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using Sween Topical cream, especially if you are applying this product to the breast area. When using Sween Topical cream, it's important to be aware of potential drug interactions. This cream may affect how other medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without consulting your doctor first. Always follow your doctor's recommendations for the best results. If this medicine is swallowed, it could be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222. In Canada, residents can contact a provincial poison control center. To help prevent dry skin, it's important to use lukewarm water when bathing, take baths or showers less often, like every 1 to 2 days, keep baths or showers short, and use a humidifier when the air is very dry. There are various types of emollient products available, including some with fragrance or other ingredients that may cause sensitivity in some individuals. Emollients come in different forms like oils, creams, lotions, or sprays. It's best to consult with your doctor or pharmacist to find the product that may be most suitable for you. If you forget to use Sween Topical cream on your regular schedule, just use it as soon as you remember. But do not use extra cream or apply it more frequently than directed to make up for the missed dose. Before using Sween Topical cream, make sure to check the storage information on the package. If you have any questions about storage, ask your pharmacist. Keep all medications away from children and pets. When storing the foam canister, avoid exposing it to high heat and do not store or use it near an open flame. Since foam canisters are pressurized, do not puncture or burn the canister. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. As for the use of Sween Topical cream, it's best to apply a thin layer to the affected area and gently massage it in. This can be done 2 to 3 times a day, or as directed by your doctor. Make sure to wash your hands before and after applying the cream. Remember to use it at the same times each day for the best results. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.